up your mind. There's so many reports and so many things. He maintains they delivered when he was there, and he used the right kind of card system to encourage performance. Now, let's bring you this story. Africa is lagging behind in the COVID-19 vaccination drive, with the countries like the US, UK, and those in the EU having vaccinated more than 50% of their population. What can be done to encourage vaccinations on our continent? For more on this, I'm joined now by Dr. Phionah, Atuhebwe, New Vaccines Introduction Officer, the WHO Regional Office for Africa. Dr. Atuhebwe, good afternoon. Thank you very much for your time. What do you think can be done to close the gap currently where the continent is lagging behind in its COVID-19 vaccination drive? Dr. Phionah Atuhebwe, are you there? Can you hear me?
I'm here, but I don't hear in the studio.
Okay, can you hear me?
I can hear you.
Yeah, we are live on air. You are live on studio on eNCA. And my first question was to you, what do you think can be done to improve the COVID-19 vaccination drive on our continent?
Oh, thank you very, very much. Yeah, so there's a lot that needs to be done. We know we started well at one point, and then we saw a peak, and now we've seen things going down. But right now we have asked countries to do what we call intra-action reviews, which is a process in which a country sits back and gets to the table and sees what is actually going on, identifies bottlenecks, identifies best practices, and through this they update what we call a national development plan, which is the overall plan that guides their rollout, which goes also sub-national to the district up to the local level and the health facility. So also countries need to ensure that they get enough funding to be able to roll out, to operationalize the vaccine. Again, media information to the communities. We assume that information has gotten out there. Most of the information that gets to the hands of the communities, especially social media, is negative information about the vaccine. But countries need to ensure that they're equipping their populations with the right information and following this up. But also to ensure that they share their lessons learned and knowledge from different parts, because we also see within the countries, even within each one country, there are disparities in the uptake. So we need the country to work from national leadership, the political will to trickle down right from the national level to the sub-national level.
What about
and of course to ensure.
Yeah, what about the availability of vaccines? Because some countries may not afford. I mean, there was this COVAX facility for Africa, but there is a challenge still in accessing vaccines. What's WHO's view?
Right now, vaccine doses are not our problem anymore. We had issues with the vaccine doses, which was in the past few months, but really starting September, October, we've seen that vaccine doses are no longer a problem. What we are seeing now, incidentally, is the fact that countries are saying no to the doses because they are unable to consume them. So we are no longer facing an issue of vaccine dose shortages. We are now facing an issue of absorption, thanks to the richer countries that have donated these doses, especially the US and the European Union.
Okay, thank you very much. We'll have to leave it there. That's Dr. Phionah Atuhebwe, New Vaccines Introduction Officer, the WHO Regional Office for Africa, bringing us to the end of the Thursday edition of our program this afternoon.